Hello everybody, I am Dr. Meenakshi, and in this video we are going to be discussing another topic which is in TOG 2023. So firstly, I would want to wish everybody a very happy and a healthy new year. So the topic is large for gestation age in non-diabetic mothers regarding the shared management plan. So what does large for gestation age mean? It is also called as macrosomia or big baby. In general, we refer to when the estimated fetal weight is more than 90th centile. But as per the NICE guideline, it is referred to when it is more than 95th centile as compared to the estimated fetal weights when taken on average. And as per the RCOG guideline, when the estimated fetal weight is more than 4.5 kilos, we consider it as large for gestation age or macrosomia or big baby. In England, approximately 10% of the babies weighs more than 4.5 kgs. So whenever the estimated fetal weight goes higher, there are some effects which can affect both mother as well as the fetus. Coming to the mother, of course, there is an increased rate of having emergency cesarean section, having increased rates of having 3rd degree or 4th degree perineal tear, and also increased chances of having postpartum hemorrhage. And when it comes to the fetus, there could be chances of having bone fractures, let it be humerus or clavicle, etc., brachial plexus injury, shoulder dystocia, and also having increased neonatal admissions into the neonatal unit, that is the NICU, as well as increased chances of having neonatal hypoglycemia. But we see that about 48% of shoulder dystocia, the babies weigh less than 4 kgs. And then regarding the screening, how do we screen for large for gestation? As such, there is no particular guideline in the UK, but in case we see clinically the symphysiofundal height, when it exceeds 2 centimeters as compared to that of the gestational age, that's when we suspect LGA, and therefore we refer for the ultrasound screening so that we can diagnose it. And also there could be some false errors which are positive, which are possible out of having the ultrasound. So how do we manage the large for gestation age is the core of this article. So we do something called as shared decision making. So whenever you diagnose either by terms of some symphysiofundal height or in terms of ultrasound, whenever the LGA is diagnosed, the first thing we do is the OGTT, the oral glucose tolerance test, to rule out maternal diabetes. In case the mother turns out to be positive for diabetes, then you have to refer her to the diabetic specialist. If there is no diabetes, that's how you evaluate further. We keep doing frequent ultrasound monitoring to monitor the fetal weight, and at term we discuss regarding the different management plans. Either we go for expectant management or induction of labor or cesarean section. We counsel the woman regarding the 3 different options. So this is what we call as shared management, because even the mother is involved in terms of decision making. So when you counsel her regarding the expected management, that means there is no involvement from our side and we just allow her to deliver naturally and we do not induce her, and we found that there is no increased risk of BPC or BIPC, you can remember it as, when compared to induction of labor. There is no increased risk of brachial plexus injury, perinatal death or cesarean birth. All these 3 are not very much increased as compared to that of induction of labor. But what is increased is increased risk of having shoulder dystocia. And for induction of labor, we see that there is an increased chance of having 3rd or 4th degree perineal tear, but the shoulder dystocia incidence is found to be little bit reduced. And coming to the cesarean birth, when we counsel her, we tell her that the risk of having a brachial plexus injury is definitely not completely terminated, or shoulder dystocia, we cannot completely eliminate the risk. So that was the summary of the TOG article 2023 regarding the large for gestation age. I hope you all found it useful. Please go through the guideline once again. I will be pinning it in the first comment down below. Until then, happy studying. Please subscribe to my channel. Bye.